Good morning, everyone. It's Dr. Charlotte Hodges, and as I go on my morning walk, I wanted to talk a little bit about what to expect the week before surgery. I have had quite a few patients ask me to make some videos on what to expect before surgery, what to expect afterwards. So I'm going to make a series of some little individual videos. That way you don't have to just listen to one long video. You can just find the video that fits for your particular situation. So this will be part one. So what to expect the week before surgery. So every surgeon will do a preoperative diet a little bit differently, and I will tell you every surgeon thinks that they are correct. In my practice, I do full liquids. That means anything you can drink through a straw. That does not include Jello. And so basically any thickened liquid, nothing with lumps or bumps. So if you want to do protein shakes, if you want to do one of my famous milkshakes with Halo Top and Fairlife, go for it. If you want to do broccoli cheese soup, stick it in a blender, make sure it's well blended. Clam chowder, stick it in a blender, make sure it's well blended. Tomato basil soup. I think you kind of get the drift. So it's basically a thicker soup or drink. You could do V8 juice if you'd like, if you want. But it's any thickened liquid with no lumps or bumps. The purpose of your liquid diet prior to surgery is that for me, it serves two purposes. Number one, it's going to help to shrink the size of your liver. The left lobe of your liver flops over your stomach, and whether you're having a sleeve, bypass, switch, you name it, we have to put a little retractor in to crank up on your liver. The liver is kind of mealy. I mean, at some point in our lives, all of our moms or grandmas have made us try to eat liver and onions. And you know how there's like a little thin covering around the liver, and then inside it's kind of crumbly? Well, that's what our liver is like. So the only thing that's protecting that liver from being crumbly is that little protective layer. If you have a great big boggy liver, which is what you can have whenever you're overweight, or actually just any patient can have a large liver, but particularly in my patients with higher BMIs, they can have a much bigger, thicker liver. When I go in with my liver retractor and crank up, there's a chance that I could crack or injure the liver. That can cause bleeding. And at the time of surgery, I give all my patients a blood thinner. And so certainly if you're on a blood thinner and then you get some bleeding, you might just bleed more. So that's number one. It makes surgery just safer. Also, it makes it easier. If somebody has a great big floppy liver, it can impair my ability to really get good visualization of your stomach. The second reason why I kind of like those liquids is, you know, I don't make patients do a bowel prep whenever they're having surgery. There's really no indication for that, but I do find that just being on a liquid diet, that kind of helps to decrease your risk for getting constipated after surgery as well. So please, please, please do your liquid diet. It's a great chance to try out lots of different protein supplements because everybody's going to need to do their protein whenever they're done with surgery. So hope that this was helpful. Get creative. Get out your ninjas and your blender or your hand mixer and go to town. You can spice things up, zhuzh it up. I'm not super concerned if things are high fat or high sodium because you're about to have surgery and you're going to knock off all that weight. All right, so hope this helps. Give me a thumbs up. Don't forget to subscribe, and please share this with your friends. Bye.